Turning to your health, we are tracking flu cases as we begin transition into spring. Ohio has seen elevated levels of flu activity across the state so far this year.
Now, many are tracking case numbers and asking what they can do to prevent catching it. Joining us now is family nurse practitioner Sara Wilson-Rector from Premier Health. Sara, thanks for being with us.
Absolutely.
Have you been seeing cases spike or decrease recently, and what's been driving that?
So I would say the office itself seems like maybe we've not seen as many positives in office recently, but I will say we've had tons of sick visits. But if we look across really the state, we're actually seeing kind of another rise here just in the last couple of weeks. We've had a really obviously heavy rise there in January, dropped off a little bit in February till kind of the end, and over kind of last couple weeks of last week of February to early March, we're kind of seeing it spike back up again. Which is not always uncommon, especially sometimes in some of our rougher flu seasons.
So how does the flu spread to others, and what can we do to be mindful of that?
So flu is spread via basically what's called droplets. So predominantly when people are coughing or sneezing, flu is going to spread. And so the best things that we can really do to prevent that is, well, one, obviously, usually we would say always get your, yearly seasonal flu vaccination. But secondarily to that, washing your hands super frequently, covering your mouth, obviously, if we're coughing or sneezing, trying to avoid some of those large environments if you're not feeling good, so that if there's a chance that you're feeling, maybe starting with the flu and you just don't realize it yet, that you're not spreading it to others. And then the other big thing is, honestly, masks are great. Masks really work well for things like influenza. So if you're going to be in a large environment, it's very useful to wear.
What is the difference between flu A and flu B, and what are we seeing more of?
So I would say this year we're seeing a little bit of a combination. Flu A tends to be a little more aggressive. People oftentimes feel a little bit worse. Influenza A can affect both people and actually animals. And so in that case, basically a wider option of spread, if that makes sense. So it tends to really get people down. We usually see influenza A sometimes a little more frequently in the earlier part of the season. And then as the season kind of drops to the later months, usually influenza B. Influenza B is predominantly usually humans only, but I'd say both of them can make us feel pretty poorly. I'd say the biggest difference with flu B, sometimes we see this mostly a lot with kids, but technically can affect anybody, is in addition to respiratory symptoms, vomiting and diarrhea.
All right, we have about 30 seconds left, but for those who get the flu, what are some treatments to help someone recover?
If we can see you super early, ideally within the first 48 to max 72 hours, Tamiflu does oftentimes help. But otherwise, lots of rest, lots of hydration, and things like Tylenol and Motrin to help with the fever and just overall aches and pains.
All right, family nurse practitioner Sara Wilson-Rector from Premier Health, thanks for being with us.
Absolutely.